My name is Areeba Basit. I am a pediatric neurologist. I come from a family of doctors. Both my parents are physicians. My dad is a neurosurgeon, my mom is an OB, and having grown up with them, we've always been very inspired by what they did, how much effort they put into just being in the medical field, taking care of their patients, teaching us what it felt like, sharing experiences with us, and that was one of the main factors that led me into the field. From the very beginning of medical school, I felt like I was meant to be a pediatrician. I felt like I connected with kids more than I did with adults. I felt like I empathized with them a little bit more than I did in general with adults. I felt like just being a part of that particular family and understanding how difficult it is to have a child who is sick just drew me into that field. And I felt like I knew right from the beginning that I wanted to be a pediatrician. And if, as a neurologist, if I can help them even improve their quality of life even a little bit, I feel like it's satisfying. It's helping them, it's helping their entire family. And that's what drew me to neurology. I think it's very important to not only develop trust with the family itself, but also actually go down to the level of the child. Say, for example, he likes to draw. You can assess his fine motor skills by just telling him to draw something that he likes. So there's a lot of things that you can determine in different ways. And if you interact with a child and you engage them in things that they like doing, they are going to trust you, they're going to like you, they're going to agree to do things that you want them to do, so you can determine what's going on. I think the reward just shows when you see a patient back after their acute phase, for example, and you see how well they're doing, how they smile, how they're grateful for whatever care has been offered. Or if the child hasn't been doing really well, but you're holding their hands, you're walking with them, and they're grateful, they're appreciative of whatever efforts you've put into it. It makes you feel so great. It feels like whatever work we're putting into all of this, all the efforts, all the on-calls and the 3 a.m. phone calls are all worth it. It ultimately results in a child that's healthier, that's happier, and that's really all that matters.